Hello and welcome to 5 and 5, the only place to get 5 valuable clinical tips you can start using ASAP in 5 short minutes. I'm your host and fellow dermatologist Gary Goldenberg, and today we're joined by my good friend Dr. Roger Seeley with 5 clinical tips on the management of benign skin lesions. Roger, welcome. Let's hear your tips.
Gary, it's great to be here. I thought we were doing 5 on 5. So fasten your seatbelts and put up your tray tables. We're going to blow through some 5 tips that I think you'll find useful. First one is electrocautery for the treatment of sebaceous hyperplasia. Patients hate these lesions, and anything we can do cheap, effectively, and efficiently is useful. This is a patient of mine who had very extensive involvement on the forehead, as you can see on the left. We just lightly put the battery cautery on the surface till they barely turn gray. You can see what it looks like, and then immediately post-treatment. Here we see, and this is the instrument we use. They're inexpensive, reusable, and we get ours from Delasco. So here's the same patient on the lateral cheek. We treated a lot of lesions there. You can see what it looks like immediate post-treatment. No wound care, anything afterwards, and you can see what it looked like 6 weeks later. No pigmentary changes, no signs of scarring, but don't do anything more than just lightly cauterize them.
Roger, that was a great tip. Let's hear your second tip.
Well, we all are frustrated with warts. I call them ego deflators for dermatologists.
They really
you
are.
treat them, they come back and laugh at you. So anything that's useful to treat recalcitrant warts is helpful. We found that Injuma butate or Picato gel for warts is effective if used properly. Dr. Badia shared this small study with me where they treated him with the 0.05% daily for 2 days, either with or without occlusion. Best results with occlusion. Here's a patient applied initially day 1, and a nice reaction day 2, reapplied with occlusion, and here we see what it looks like at day 8. Good inflammatory response, and day 57 appears completely resolved with no signs of scarring or recurrence.
Ego deflators, they really are. It's a great tip. Let's hear tip number 3.
Hydrogen peroxide for molluscum contagiosum. Molluscum, again, are frustrating. We need to find something to have the patients do before they go away on their own, but also prevent them from spreading. So this report in the European literature, where they used 1.8% hydrogen peroxide gel under occlusion twice a day, and they found really many fewer lesions, not great complete clearance, which you wouldn't expect. This gel in a lower concentration, 1.7%, is available in the U.S. as a periodontal gel that's used. And so this is something useful I think you might find helpful in your practice.
That's right. Let's go tip number 4.
All right, moving on with hydrogen peroxide, it seems to be the word of the day. For seborrheic keratosis. Seborrheic keratoses are a problem also. Patients are annoyed by them. They come in thinking they're cancer. They're irritated, they're itchy, they want them treated, but they don't want to have scarring. They don't want to have pigmentary changes. So a recent study showed that the 40% concentration that was developed by Aclaris got 68% clear or near clear, which is pretty darn good, with very minimal local skin reactions and no significant scarring or pigmentary changes. So it's been recently approved. This is what it looks like when you apply it at the various stages. 20-second application, 4 applications for warts, a minute apart. So here are some examples. A level 4, grade 4, seborrheic keratosis, kind of an ugly lesion on the cheek. Really nice resolution to clear. No evidence of seborrheic keratosis that I can see. There is one that's not quite so thick, but good resolution in my mind. I'm sure the investigator could see something. This was rated as near clear. So this solution is safe and effective for treating seborrheic keratosis. In my practice, it's going to be for the face or the neck, and there's minimal risk of scarring or hypopigmentation. The product is going to be available soon. It's called Escada by Aclaris, and hopefully we'll have this in the next few months.
I think anything you can do to seborrheic keratosis that doesn't cause hypopigmentation is really, really impressive. Let's hear your last tip.
Finally, ALA PDT has been used for everything under the sun. I was intrigued by reports of treating sebaceous hyperplasia, so I've tried this in my practice. A number of authors have talked about it, how effective it is. And here's an example of a patient that pre-treatment, after treatment, and nice resolution afterward by Dr. Horio. And here's another case, a patient Dr. Gold shared with me that resolved nicely. In my practice, what I do if I'm treating a patient with PDT for AKs, I'll apply twice to those areas, and they're sometimes happier about getting rid of the sebaceous hyperplasia than all I did for the AKs for them.
Roger, that's great. These are great tips. Thank you so much. This is 5 and 5. Until next time.